A bunion is an enlargement on the inner aspect of the foot. It may be swollen or inflamed. Actually, numbness may develop on the border of the toe. With time, the toe deviates outward towards the lesser toes where it can cause an abnormality. Whether bunions are small or large really isn't the case. What is important is how much pain there is, and that's usually what brings a patient to see a physician. Bunions have been described in the literature from Socrates to Shakespeare. And it's certainly been recognized that while bunions are a source of pain, that shoes really are the culprit in many of these problems. Let's look at the following picture, and we can see a man's shoe, and we can see that it really conforms to the shape of a man's foot. And really very seldom do men develop problems. Now in this next photo, what we'll see is a woman's foot and a woman's shoe. And you can see that there's a lot of compression that develops on the inner aspect of the foot and actually on the outer aspect as that shoe compresses the foot. And here is an x-ray of the foot, not in a shoe and in a shoe, and you can see the real deformity that occurs. And over a period of time, a bunion and other problems may develop. Why a bunion occurs really is not always an easy question to answer. Certainly, shoe wear plays a role, but as you can see in this picture of a native in Africa who's never worn shoes, bunions can develop, but they certainly aren't severe and they're rarely symptomatic. We also feel that genetics plays a role in bunion deformities. In my practice, I see certainly a grandmother and a mother and a daughter with various bunion deformities. So genetics does play a role. Also, I'll see a person with a bunion on one side and not on the other. So we don't have all the answers to our questions of why bunions occur. But there's no question in my mind that shoe wear does play a role, and sometimes there's a foot at risk that will develop a bunion deformity. Now let's look at a model. I think that a model can help us really understand the pathology that develops. We're talking about the first metatarsal and the toe. And when a bunion develops, the first metatarsal deviates away from the second metatarsal. At the same time, the toe deviates in and may even rotate a bit. I think that x-rays will tell us a lot about the deformity, how advanced it is, if there's an element of arthritis, and it helps us to determine the correct treatment. So let's look at some x-rays and help us understand exactly what occurs. In this first picture on the left-hand side, notice the two little bones that are colored green. They're actually underneath the first metatarsal. They're called the sesamoids, and actually everyone has them, but they're just not aware of it. As the toe deviates, these two sesamoids move away from underneath the metatarsal, and you'll appreciate those as we look at the next sequence of x-rays. This first x-ray is of a mild deformity. You can see that there's just a little bit of angulation of the toe. Now let's go to the next one, which is more advanced, and you can see that the toe is deviating inward as the metatarsal deviates outward. And lastly, you can see a more severe deformity in which there's significant deviation of the toe. As a more severe deformity occurs, the big toe actually rotates and the toenail points inward. Pain may develop in the joint over the bump, but also in relationship to the smaller toes just next to the big toe. Some things can be done to reduce your pain, like choosing the right shoe. Now, you may or may not have worn a fashionable shoe, that is a high heel or with a pointed toe box, and that may have caused your problem. Now this isn't a gorgeous shoe, but it's a shoe that an older woman might wear, and you can see that there's soft leather and that has certainly not a narrow toe box or a high heel. Now let's look at another model of a shoe which might be a little more acceptably fashionable. It's certainly not high fashion, but in this one we can see that the shoe actually conforms to the shape of the forefoot. There's a wider, roomier toe box that doesn't squeeze the forefoot. It lowers the heel, which decreases pressure on the forefoot region. Wearing comfortable shoes is probably the most important and wisest thing you can do. Obviously, even with fashionable shoes, you can wear them some of the time if you just watch how much time you spend in them and lower the heel a bit. Let's look at two other examples of shoes that might be reasonable to wear. We see in this first picture a lower heel, and we see in the second picture a rounded toe box. One piece of advice I give to my patients is wearing high fashion footwear is kind of like a rich dessert. For the dessert, if you eat it often, you'll get heavy. For the high fashion footwear, if you don't use them very often, it's doubtful that you'll develop foot problems. You need to be conservative in your use of high fashion footwear, and when possible, wear shoes like I've shown you. Shoe modifications are another alternative. And what you can do is you can take a shoe to a local shoe shop, and they can stretch the area on the shoe a 1/4 of an inch or so, and it's amazing how much relief of pain you'll get from just a change in the outline of your shoe. Please remember that there's nothing good about a break-in period of time with your shoes. It's your foot that's actually stretching this shoe in order to make it fit. If a salesman says, well, it'll fit in time after a break-in period, it'd best be to buy another pair of shoes that actually feels good right from the start. And the last piece of advice is around your household, you can wear slippers or socks, and that's quite acceptable. Let's look again at how a bunion deformity comes to be. In this photograph, we see a patient in 1986 with a moderate bunion deformity. In this next photo, we see her 5 years later with a much more severe bunion. But it all starts out usually with a normal foot. And here's a photo of a normal foot, and here's the x-ray of the bones underneath, and you can see that the first metatarsal and the proximal phalanx line up just in a straight fashion. In this next photograph, we see a moderate deformity, and the toe adjacent to the big toe is actually cocked up a little bit. And this is the x-ray of the bones underneath, and we can see that we have a more advanced deformity. And next we see a severe deformity with the great toe actually coming underneath the second toe, and here are the bones underneath. You can see that this is truly a severe deformity. If in time these conservative measures don't help, then surgery may be necessary. In general, surgery is reserved for people with a substantial amount of pain. It's certainly nothing that needs to be rushed into. Surgery is an option when these other measures are unsuccessful. What I've tried to show you earlier in our discussion is that x-rays play a role in our decision-making process. After we've evaluated the x-rays, we try to make a decision on the appropriate surgical procedure. For a mild bunion, we may do a procedure that is less complex. For a more severe deformity, we may indeed do a fairly complex procedure. So let's look at some of those options, because it depends really on the nature of your deformity, what will be the appropriate treatment. Occasionally, we may just remove the prominent bone as we see in this first diagram. This usually is not enough because the toe often is deviated outward and the metatarsal inward. Here's a preoperative x-ray where we see a relatively minor deformity, and here's the post-op x-ray as well. We've obviously removed the prominence over the bunion, but we really haven't changed the angulation. For mild deformities, we often perform what's called a chevron bunionectomy. In that, we will remove the inner bone over the bunion, and we will do a V-shaped cut in this region. Now let's look at some diagrams and x-rays. In this first diagram, you see the chevron type osteotomy or bunionectomy from the top. In the next photo, we see a bunion deformity before surgery. Next, we see after the bone has been cut and the metatarsal actually moved towards the outer aspect of the foot, and there's a pin holding the cut bone in place. And lastly, we see the finished product, which is a few weeks down the line when the bone is healed. So this is a good example of the treatment of a mild bunion deformity. For more severe deformities, we'll do what we call a man bunionectomy, and let's look at a model of that as well. When we perform a man bunionectomy, we remove the bump, as we did in the previous procedure, but we actually cut the metatarsal in this region in order to angulate it in an inner direction. It's usually fixed with both a screw and a pin. Let's look at some examples of this procedure. In this first diagram, we actually see a schematic drawing of a screw and pin after the curved cut has been made to correct the angulation. Let's now look at a preoperative x-ray of a patient with what I would say is a severe deformity. Let's look at what her foot looks like. You can see that the big toe is crossing over the second toe, and there's a terrific bunion on the inner aspect of the foot. Now let's look end on, and you can see how much rotation there really is in the big toe itself. Now after the procedure, you can see that we've really achieved a nice correction. We've straightened out the toe, and there's very nice alignment as well. Now we have two other x-rays that are associated with this. The first one shows one of the screws still in place, and finally we see after all the metal has been removed, we see a nice correction of that deformity. For more severe deformities, when we, for example, have arthritis of the foot, or we just have a deformity that is really too difficult to correct, we'll do what we call a fusion. And this is a nice model which shows the fusion itself. You can only see really a plate on the top of the toe, but there are actually several screws that go in, holding the bone in place until these two bones have actually healed together. We obviously give up motion with this procedure, but it's a very reliable surgical technique to correct a severe deformity. And now let's look at a clinical example of a severe deformity. In this first photo, you see a severe deformity, and I think this is just too tough to correct with one of the other procedures you've seen. And here we see it after we've done a successful fusion. Look how much we've narrowed the foot with doing this fusion. If surgery is appropriate for your condition, let me speak to a few important things. First of all, about anesthesia. Many years ago, people went to sleep for this type of surgery, but now with creative anesthesia, we can anesthetize the nerves in the lower leg. What's nice about this is that you can be as awake or asleep as you wish, and often people choose some sedation. But the block lasts for probably 18 to 24 hours, so with your foot being numb for that length of time, pain really is reduced for almost a whole day, and I think that's important in trying to do this with a minimal amount of discomfort. So surgery is frequently done on an outpatient basis. We're very concerned about keeping pain under control, and we try to be creative in using both pain medicine and anti-inflammatory medications to help you during this difficult period of time. There are other things that will make a difference in your pain control. Ice and elevation are very, very important. Getting your foot and ankle above the level of your heart and icing it down for those first few days can make a major difference in relieving your discomfort. I think also that the way that you get around is important. And what I mean by that is we use a bunion shoe to protect your foot as you walk from place to place. And we'll use this for about 8 weeks in the recovery period. You may use crutches for a few days, but pretty soon you'll be able to walk in this shoe, although you'll tend to bear weight on your heel and on the outside of your foot to protect the inner aspect where you've had surgery. What we've tried to do is discuss the important facets of a correction of a bunion deformity. Certainly surgery is important, but your participation is equally as important. And frequent office visits are important to monitor the healing, both with x-rays and with dressing changes. We want to make sure that we optimize your recovery process after bunion surgery. Thank you.